They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. My name is Lacey Spence and I'm your host. And today we are talking about same-day joint replacement. We've got two fabulous guests here from Carle. Can you please introduce yourselves? We'll start with you.
I'm David Zeman. I'm an orthopedic doctor and I've retired from doing surgery.
Okay.
So I see patients, many times I'm the first person to order an x-ray on them when they come in with a sore joint. And when I find one that really looks like they have a big problem, I send them to Dr. Manohar or one of her colleagues, and they can do joint replacements.
Perfect. And we'll scoot down to you, Doctor.
Hi, I'm Dr. Manohar. I'm an orthopedic surgeon. I'm board certified, fellowship trained in total joint arthroplasty, and I do hip and knee replacements. I've been at Carle for about 6 years now. I'm from this area, so I know this area very well.
Perfect. If you wouldn't mind sharing, you and then you, how did you guys get into the field that you're in?
I think for me, a real attraction to orthopedics is how much it helps people stay healthy by helping them stay active. And activity is one of the most positive influences on our health. And by contrast, debilitation and being sedentary is one of the worst influences on almost every other thing that is going on in our bodies, not just our joints and muscles and bones.
I always knew that I wanted to be a surgeon, and I really enjoy doing things with my hands, and as I went through anatomy, I really enjoyed more so the surgery of the hip and the knee, of more so than anything. And not only that, seeing how you can impact patients' lives and really make their lives, I mean, we do life-changing surgeries for them in terms of staying active, like Dr. Zeman said, for longer and doing the things that they love to do. And I just love seeing the outcomes that our patients have after they get their joints replaced.
Definitely, and I know that something that you guys both share that kind of fuels what you're doing has to do with both being active as runners. Is that right?
Yes.
How did you guys get into running?
For me, it was President Kennedy's youth fitness program.
Okay.
They made us go out behind Northridge Junior High School in Danville and run 600 yards. And I thought that was fun. So I was hooked.
Awesome.
I run just to stay active and healthy, and I really enjoy the challenges with running, and it's a good way to let off some stress too. And I do a couple of 5Ks and 10Ks once in a now again once we get back to doing some races.
Yeah. Perfect. Well, as we're talking about joint replacement today, for folks who have no idea what this is, can you kind of give us a little intro to it?
Sure. So joint replacement surgery is what we do at the end stages of arthritis. So patients come in, you've been told you have a little bit of arthritis in your joint. We try to do some basic things to try to prolong the life that they have of their regular joint, their native joint. As time goes on, unfortunately, their joint gets worse and worse and more arthritic. So once you wear away all the articular cartilage, the cartilage that coats the ends of the bone starts to rub on each other, and most patients start saying they feel a grinding sensation or a bone-on-bone type of a pain. And that's truly what we see on x-rays. We see that there's no joint space left, and their bone is literally rubbing on bone. So joint replacement is when we go in and we take out that bad part of the joint and we put in metal and plastic, which are man-made materials, and make everything nice and smooth again and try to restore the function of the joint with man-made parts and pieces.
So at what point do I need to be coming to see you? Because it might be a little hard to tell if it's just a regular exercise ache and pain or if it's something more serious.
Right, so usually when you come in, and like Dr. Zeman said, you could come in, we get some x-rays, we see how your joint space looks. When you first come in, most patients are young, they don't have a ton of arthritis on their x-rays. Sometimes we can get by with other conservative measures. So bracing, some physical therapy. There are different types of joint injections that are FDA approved and also approved by a lot of insurance companies as well. Corticosteroids or steroid injections, cortisone shots is what sometimes the patients also call them. We also have different types of viscosupplement injections, which are a gel type of injection that goes into the joint to help lubricate things. So there's a couple of different options to do to try to put off that joint replacement surgery. Obviously, you don't want to do joint replacement if you still have a functioning joint. You're able to control the pain with non-steroidal pain medications, different types of injections, staying as active as possible, weight management, and those types of things. So joint replacement is really the last resort before when everything else fails. So we don't want to do the joint replacement too early.
Fair enough. And Carle's been doing same-day joint replacement surgeries. What types of patients do you usually see? And how can a patient get ready for his or her joint replacement?
Well, you're looking for a patient who has the ability to follow directions and have a certain ability to take care of themselves. They can't be in ill health. They usually need good family support. Often it's very worthwhile to make some modifications to their home environment, like removing trip hazards, and a lot of people will put their pets in a kennel or send them to a friend for a while just to avoid mishaps when they're freshly post-operative.
Mm-hmm. How important is it to have a good mental attitude as you're heading into something like joint replacement?
It's extremely important. I think especially for knees as opposed to hips, because a lot of people have trouble getting their knee to bend with a fresh scar in the front of it, and a lot of people don't have so much trouble with that. And we're struggling to find out exactly why that is, but a lot of it does seem to have to do with attitude.
And especially if it's going to be several weeks of rehab, trying to keep your spirits up through that, I'm sure, kind of plays a big part in it.
Mm-hmm.
Fair enough. So how did same-day outpatient surgeries come about at Carle?
I think it had something to do with the COVID crisis.
Okay.
There was pressure that way, and I consider myself sort of a dinosaur. I can remember the day when, first off, we never worried about what any health care cost. Mm-hmm. And we actually thought people liked going in the hospital and having breakfast, lunch, and dinner in bed and, being taken care of, being away from all the home stresses for a week or so. But that doesn't seem to be the way things work these days.
Right, so like Dr. Zeman said, a lot of this did arise from the COVID pandemic. Even before that, we had orthopedic surgeons across the country doing, next day discharge, 23-hour stays, and then there are some institutions where they were trying to do some outpatient joint replacements. And with the pandemic, looking at our Hip and Knee Society surveys that have been put out, a lot of surgeons and patients have felt the need to recover in the comfort of their own home, and we found a way to make it safe to do so. So at Carle, what we did was, when the pandemic struck, we could not operate for two and a half months. So we looked at the patients that were on the schedule and tried to see, well, which one of these patients were motivated individuals, had a good support system at home, and were medically stable to be discharged the same day. And so looking at all those criteria and taking a look, really delving into their health history, seeing if those patients could be set up with a system to go home. Next, what we did was we talked with our inpatient nursing staff, our outpatient nursing staff, and also our home health, Carle Home Health services that we have available. So talking with all of these little pieces of the puzzle, trying to see what we can do at home with the patient to help them recover in a safe fashion. So what we've done is we were able, with the home health care services, set up a nurse that would come out to the house the very next day, do a nursing assessment, pull any drains that needed to be pulled, go over medications and discharge medications, discharge instructions with patients to really help them with their recovery process. The next piece of the puzzle was getting a therapist on board. We were able to set up having a physical therapist see the patient the same day after their surgery. Within hours, the patients are up and walking. Some of them are able to do stairs if they need to negotiate stairs in their home, or a couple of stairs to get into their house when they get home. And so we make sure they're safe for discharge. And that's done by the inpatient physical therapy department that we were able to do in the hospital. Then we have set up with the home health services a therapist that comes out to the house for a couple of weeks to help the patients recover at home, doing some basic exercises over the first couple of weeks at home as they recover. And then after that, they transition slowly over the next 2 weeks to outpatient therapy, where they're able to go and work with an outpatient therapist, where there's a lot more specialized machines and things they can do as they progress in their recovery. So there's a lot of little pieces to the puzzle that had to be worked out, but it seems to be going really well for a lot of our patients.
So this came out of necessity, but it seems like it's something that you guys are going to be hanging on to.
Right, so just like telemedicine, which has been an integral part of seeing patients during this pandemic, and doing Zoom meetings and seeing patients and answering their questions, this has been a great way for patients to go home and recover safely and efficiently. They get to sleep in their own bed, they get to stay away from any nosocomial or hospital-based infections, and of course the pandemic. So that's something that patients are really finding that, hey, I really like recovering at home and I can do this on my own, as long as they have everything set up in advance.
And what did things look like before this had to be put in place? Was it a real stretch for patients to be stuck in the hospital, or was it an okay experience for them? What did it normally look like before?
Right, so there's been a trend, and I know Dr. Zeman said, back in the day, patients would be in the hospital for a week after their joint replacement and on pain pumps, but slowly over time, we've come to 3-day stays and 2-day stays we've transitioned to over the past couple of years, and then to 23-hour stays even a year to year and a half before the pandemic. So that trend has been occurring, and this was just the next progression in the phase of going home after your joint replacement.
And it has taken more and more planning before admission, even to
Yes.
get to the 3-day stage, the 2-day stage, and so on, to be able to do a short admission elective surgery. So it's not like the process emerged out of nowhere.
Right.
It's been going on for a while.
Fair enough. So what does a typical day look like for you as you are welcoming in a patient? What are they seeing you for?
Well, I often will say that I'll see a ham sandwich. In other words, I'll see a patient for anything that they or their doctor want them to get into the orthopedic department about. And just as Carle has taken a lead in recruiting a lot of subspecialists into our group, to the extent that there is no general orthopedic surgeon operating in our group anymore, they also took a lead in recruiting me to come here as a non-surgical general orthopod. So I will see all kinds of things, and a lot of times people will come into me and say something like, I'm here for my hip, and they'll point at their low back. Mm-hmm. And those are the issues I have to sort out and figure out what we get an x-ray of and what kind of initial measures might be taken. So some people say that my work is kind of like detective work, because I'm trying to listen to what they are trying to say and figure out what the problem is. So a lot of my activity is more diagnostic and preliminary treatment, like the things Leslie was talking about that we would always want to do before somebody really thinks too hard about a total joint.
And I know you were telling me earlier, you guys are about a hallway apart. So at what point are you sending the patients they're done with you and they are moving on to Dr. Manohar?
The patient knows.
The patient knows.
Because the whole indication of a joint replacement is pain. And I'll often say to them, if I'd been smart enough to go into politics, I'd tell you that I feel your pain. But just being a doc, I've got to listen to them, and they know when they hurt enough, and then we look at the x-ray, and if we still see some joint space, that isn't space, it's filled with cartilage, which is wonderful, valuable stuff that has no nerve endings in it. So it feels good to rub on it all day and put force across it. But bone is very sensitive, well-innervated tissue. And when you're moving that bone-on-bone surface, it feels bad.
Mm-hmm. And the folks that are coming to see both of you, do you typically see younger patients who have maybe more athletic injuries, or older folks who have just gone through it?
Yeah, so I mean, it's sort of a mix. You know, I do, as a specialist, I do see some unfortunate younger folks that have their joints replaced. We have different types of conditions. Avascular necrosis, when the bone collapses and dies in a hip or a knee region. When we have patients who have bad trauma, like a motor vehicle accident when they're young, and then they've had to have surgery, and then that goes on to collapse. That joint has arthritis and goes on to collapse sooner than someone in their 60s. And so we do see, unfortunately, a lot of younger folks who want to stay active that do end up with early end-stage arthritis that need to have their joint replaced. The good news is that we do have different newer materials and newer polyethylenes or plastics and newer metals, and the way we put the implants in does provide us the ability to provide these patients with joint replacement if they're indicated, as opposed to 20 years ago, 15, 20 years ago, when these patients did not have a lot of surgical options and would just have to wait until they were a certain age to get their joint replaced.
And so, other than weight management, what type of advice would you two give to folks at home to try to get ahead of this, to prevent this so that it's not as bad by the time they're coming to see you?
A big one is alternative exercise. Many times people are running until they start getting arthritis, and then they switch to walking, and then the impact of walking gets to be too much. And a lot of people do a lot better with an elliptical trainer. Some do great on a stationary bicycle, but particularly people with a lot of arthritis underneath their kneecaps, a bicycle will almost be worse because there's more knee motion involved. And the ultimate for alternative exercise is getting in a pool, because then they can do a flutter kick, which requires almost no force or no motion across the knee, or do pool aerobics, where they're much more in control of how much movement and force they're putting on the arthritic joint.
Is there anything you wanted to add?
They always talk about eating a Mediterranean diet or an anti-inflammatory diet, and just taking good care of your body and trying to stay as active as possible, just like Dr. Zeman said, and taking care of yourself, because you only have one body, so you really want to take care of yourself for as long as you can before you need to get a joint replaced.
And can we talk about arthritis a little bit? Is it just inflammation, or what is arthritis for folks who may not know?
The itis on the end of the word technically refers to inflammation, but by far the most common type of arthritis is sort of a misnomer. It's osteoarthritis, which is caused by the sickness of the joint cartilage, which ultimately wears it away and removes it. And that's it's more common than every other type of arthritis put together. Rheumatoid arthritis, which is where the field rheumatology gets its name, is probably the most common of the inflammatory arthritides, and most of the other ones do involve inflammation. A pretty common one also is psoriatic arthritis, which not everyone with psoriasis in their skin gets psoriatic arthritis, but that's a very destructive type of arthritis when they get it in the joint too.
And what does arthritis feel like compared to just like regular athletic pain? Is there a tell, I guess, so that I'm not just going to the doctor for every ache and pain?
It could, that's a broad question.
Okay.
It could, if you've done a lot of activity the day before, you could have sore muscles in combination with maybe some early brewing arthritis. Obviously, without an x-ray, you can't really tell about the arthritis. Some people do have underlying arthritis and they are able to get around and live their lives for a long time. Everyone tolerates pain differently, and also some people don't do a lot of, like you said, heavy impact activities that make the inflammation worse and pain worse in the joint. So sort of is a broad question, hard to tell.
But maybe if it lasts a little bit longer than just, this just developed after my run today.
Right, after like a
Gotcha.
sporting, yes, exactly. Then you should probably get it checked out, exactly.
Yeah. Probably the best hint is pain with weight bearing. And anytime there's force on the joint, it often feels worse to people when they first get up in the morning. And then as they move around a little bit, it settles down, and then it starts gradually building again throughout the day. And by the end of an active day, it can feel worse than it did in the morning. And it's very individual. For some people, it starts to settle down almost immediately when they sit down in the evening. And some people get relief during the course of the night, and some people never get relief.
What type of over-the-counter treatment can I take? Is it more of a ibuprofen or anything like that, or?
So the American Academy of Orthopedic Surgeons does recommend using non-steroidals, so like ibuprofen, Aleve, those types of medications that are available over the counter. Obviously, you have to be careful with those, especially if you have a heart condition or if you have a GI issue. So sometimes patients who do have more than one medical problem in their history may need to talk it over with their primary care doctor, who does know them best. And then for those types of patients, extra strength Tylenol, the Tylenol arthritis over the counter also does work. It works on a different pathway, but it does also help decrease their pain.
It's nice to know that there are some options you can take, especially if you can't get right into see your doctor. We're in our last couple of minutes here. Is there anything that we didn't hit that either of you would like to share that might be helpful for our viewers at home?
I was just going to mention that sometimes a cane in the opposite hand can help a lot in terms of early cases of arthritis that might respond and go along for a few years.
Is there anything else you would like to add either?
That sounds good.
All right. Well, if we are looking to get more information about Carle or contacting one of you, I assume we would need a referral from our doctor. Is that right?
It depends on the type of insurance that you have. So
Okay.
not all insurances are now requiring a referral from your primary to see a specialist. So sometimes I'm oftentimes seeing patients who just want to come in to be evaluated.
All right. Well, thank you so much for being on the show. We appreciate it.
Thank you for having us.
Thank you.
And we hope you'll join us for our next episode of Being Well.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.